Extract 1. Questions 1 to 12.
You will hear Dr. John Hope interviewing Brian Brown, who has come seeking treatment for a current problem.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. Come on in, Brian, and tell me, how can I help you?
Oh, hello, Doctor. Look, I've come here because I've got a real issue with sleeping, and I was hoping you'd be able to prescribe with them sleeping tablets.
Well, just before we go straight into a prescription for tablets, I think it would be useful if you could just tell me a little bit more about your problem.
Okay, well, it relates to my work. I work at BP Oil Refinery and I do a lot of shift work, and because of that, I've got irregular sleeping hours and I'm not sleeping well at all.
And how long has this problem been going on?
Well, I've been working at the refinery for about 3 months now.
Mm-hmm.
And I started night shift about 6 weeks ago, and it's been building up since then.
And tell me more about your work hours.
Well, basically we do 12-hour shifts in the daytime, and that's followed by 2 12-hour shifts in the night time.
And is this problem sleeping after the night shift, or is it no matter whether it's day or night?
Actually, I can sleep after the day shift, but after the night shifts I'm having a lot of trouble. I don't seem to be able to get more than 4 or 5 hours sleep after the night shifts.
Oh, that's no good. And how does this impact on your work?
Well, it's a problem because, my job's quite dangerous and we need to monitor a lot of equipment and operate some machinery.
Mm-hmm.
And I'm finding that I need to be alert, and when I'm tired, I have to resort to drinking a lot of coffee and lots of caffeinated drinks just to get through my shifts.
Right. Well, Brian, would you mind if I just went through and talked about what things we can do to help you sleep better? Because I think it's important that we do more than just prescriptive sleeping tablets.
Okay, I guess so.
Generally speaking, sleeping tablets are of short-term use only. What happens is that if we start you off taking sleeping tablets regularly, you're going to find over time you have to increase the dosage to get any real effect, and there's a real risk that you'll become dependent on them.
Well, look, I don't really care too much about that. It's now that I'm having trouble. What's important to me is that, I keep my job. You know what happened to me on my last shift? I actually fell asleep for 15 minutes and my supervisor caught me out there, and it was due to not getting enough sleep. So that's really why I've come here today.
Well, we'll go on to look about what we can do to help you over this immediate problem. But I'd like you to realise that with sleeping tablets, it's not only the fact that you may become addicted to them, but that it can actually impair your memory and your ability for critical thinking.
Really?
Now, you were telling me that you're working in quite a dangerous profession, and it's really important that you're alert, that you're not suffering a hangover from sleeping tablets.
Right, I guess I see what you're saying.
Now, Brian, I'd like to talk to you about what living environment is like, what your living environment is like. Where do you go to sleep normally? What sorts of things would make it difficult for you to get to sleep?
Well, the noise in the daytime, I suppose. There is a lot. We live in the suburbs, and if it's not one thing, then it's another. For example, a neighbour might start mowing the lawn in the daytime. We've got a lot of birds that wake me up. A lot of crows at the moment. They seem to hang around the house. Sometimes the phone rings. Even the brightness of the room, Doctor, or the hot weather. All of these things have been disturbing me.
Hello, doctor. Good morning.
Good morning. What's your problem?
Well, doctor, I have itchy red rash on my feet.
Okay, what's your age?
21, doctor.
Tell me if you have developed any associating symptoms or signs.
It is tingling persistently, doctor.
Since how long have you had this problem?
For the past 4 weeks.
Exactly on which part of your foot you are getting this problem?
Right great toe, right second toe, right third toe, and right fourth toe. Often the onset of itching starts after removing sweaty socks.
Do you drink or smoke?
I do not smoke, but I do drink.
Have you had any diseases in the past?
Well, I had chicken pox and frequent ear infections.
You had any surgeries as well?
I have surgical ear tubes.
Do you take any medications?
No, doctor.
Are you allergic to any medicine or substances?
Well, I get a severe rash when I access adhesive tape.
Any of your family members have any history of illness?
My paternal grandmother is having cataract, and my maternal aunt has migraines.
Well, your physical examination reports show blood pressure 110/64, respiratory rate is 18, heart rate is 66, and temperature is 98.6. Lower extremities is warm to cool, proximal to distal. The dorsalis pedis artery pulse palpable bilateral. Posterior tibial artery pulse palpable bilateral. No edema observed. Varicosities are not observed. Right great toe, right second toe, right third toe, and right fourth toenail show erythema and scaling. Muscle strength is 5 out of 5 for all groups tested. Muscle tone is normal. Inspection and palpation of bones, joints, and muscles is unremarkable. You have developed tinea pedis, a fungal culture of skin from right toes. KOH test shows no visible microbes. I'm prescribing Lotrimin AF 1% cream to apply 4 times a day, and Griseofulvin 250 milligrams PO once in 8 hours for 4 weeks.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at the question 25. You hear a monologue by a physician explaining about lupus disease. Now read the question. Lupus is a chronic autoimmune disease in which the immune system becomes hyperactive and attacks healthy tissue, resulting in such as inflammation, swelling, and damage to skin, joints, blood, kidneys, the heart, and lungs. Normally, our immune system makes proteins called antibodies to protect and fight against antigens such as bacteria and viruses. However, lupus makes the immune system unable to differentiate between the healthy tissue and antigens, which leads the immune system to direct antibodies against the healthy tissue instead of antigens. Question 26. You hear a discussion between a doctor and a nurse on leukopenia disease. Now read the question.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses, and they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma. Question 27. You hear a discussion between a doctor and a nurse on different stages of gout. Now read the question.
Hello, doctor. What are the different stages of gout?
Well, there are various stages through which gout progresses. In the asymptomatic hyperuricemia stage, the person will elevated uric acid levels without any outward symptoms. The acute gout stage occurs when the urate crystals suddenly cause inflammation and intense pain. This condition is also called flare that can be triggered by alcohol and drug usage, stressful events, and due to cold weather. The intercritical gout is the period further urate crystals are being deposited in tissue. The main difference between gout and pseudogout is that the joints are irritated by calcium phosphate crystals instead of urate crystals. Chronic tophaceous gout is the most debilitating stage. Permanent damage might have occurred in the kidneys and joints. The patient can also develop tophi, big lumps of urate crystals in joints of the fingers. Pseudogout is the condition that is confused with gout. Question 28. You hear a discussion between a doctor and a nurse on different types of gum graft surgery. Now read the question.
Hello, doctor. What are the different types of gum graft surgery?
Well, there are 3 types of gum graft surgery. In the connective tissue grafts, the periodontist removes tissue from the roof of the mouth by making a flap and taking tissue from underneath the top layer. Stitches the tissue onto the existing gum tissue to cover the exposed tooth root. Stitches the flap on the roof of the mouth from where they took the tissue. The gingival grafts is preferred for the persons with thin gums that require extra tissue to enlarge the gums. In this method, the periodontist removes tissue directly from the top layer of tissue on the roof of the mouth and stitches this tissue to the existing gum area. Pedicle grafts method is often preferred for the individuals having lots of gum tissue growing near the exposed tooth. The periodontist grafts tissue from the gum around the tooth requiring treatment and partially cuts away the tissue, keeping one edge attached, and stretches the tissue over or down, covering the exposed tooth root and holding it in place with stitches. Question 29. You hear a discussion between 2 doctors about medical conditions that cause undigested food to appear in the stool. Now read the question. Doctor, please, can you explain medical conditions that cause undigested food to appear in the stool? Well, if a patient is having pancreatic insufficiency, it means they lack enzymes resulting in the inability to break down the food. Crohn's disease is a type of inflammatory bowel disease that causes inflammation in the digestive tract that can result in severe abdominal pain, diarrhea, and malnutrition. Celiac disease is an autoimmune disorder where our body becomes incapable to digest the protein known as gluten that is found in barley, wheat, and in certain other grains. If the digestive system of a person has lactose intolerance, then it becomes incapable to break down the milk and dairy protein. Irritable bowel syndrome is a common condition that affects the large intestine, resulting in pain, bloating, diarrhea, or constipation. Question 30. You hear a discussion between a doctor and a nurse about different procedures to detect blood clots. Now read the question.
Hello, doctor. What are the different procedures to detect blood clots?
Well, a D-dimer blood test will measure a substance in the blood that can determine whether there is abnormal clotting activity somewhere in the bloodstream. Cardiac biomarker blood test is a blood test that can detect damage to the heart muscle. Compression ultrasound is a non-invasive test that can be performed and is often very useful in diagnosing deep vein thrombosis. Angiography or venography and catheterization techniques in which a dye is injected into a blood vessel where a clot is suspected, X-rays are also used to detect the clot. Echocardiography uses sound waves to get images of heart and are often used in patients who have had embolisms affecting an artery, especially in patients who have had an embolic stroke. A ventilation perfusion scan uses a radioactive dye to investigate blood flow to the lungs and can detect whether a pulmonary blood vessel has been blocked by a pulmonary embolus. CT scan is often the first test used to diagnose a stroke that is also useful for confirming a pulmonary embolus. MRI scans can be used to detect clots in blood vessels.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with Dr. Helen Sands about her work with patients who are learning to cope with amputation. You now have 90 seconds to read questions 31 to 36.
I'm joined today by Dr. Helen Sands, who works with patients who've had limbs amputated. Now, amputation is an extremely traumatic experience for patients. Helen, in your experience, how do younger patients tend to react to it?
Well, in a range of ways, depending on whether the loss was expected, if it was due to chronic illness, or to something sudden like an accident. One of my young patients in that situation, let's call him David, said losing his leg suddenly was like the pain of an unexpected death in the family. And although this didn't really apply to him, for many young people, even watching a football game can make them feel shut out of activities they once took for granted. But then others come to terms with the fact that for them, normality will be something different from what it was before the operation.
And patients can still suffer pain from a missing limb, can't they, even after the limb's been amputated? What's called phantom limb syndrome. How common is this?
Well, the phenomenon was first observed many years ago in soldiers who'd lost a limb in combat. The majority reported pain coming from the missing limb. Obviously, surgical techniques have improved, but a large number of amputees still report suffering from a degree of pain from the missing limb. In a few instances, this might be due to a poorly fitting prosthetic, for example, or residual limb pain, but the majority of cases are harder to explain. And patients are reluctant to talk about it in case medical professionals doubt their mental state, so it's not very easy to say just how often it occurs. However, I still tend to think it's large numbers.
And you must have come across examples of this phantom limb syndrome in your own patients who have missing limbs.
Oh, yes, of course. Many patients report feeling as if the missing limb is still attached to their body, even years after the amputation. Some patients have reported actually trying to use it just as they did before. And in the case of other patients, they feel as though the missing limb is permanently at an abnormal angle, and they have to make allowances for it when moving around. I've come across a number of instances of that. And other patients experience what we call telescoping, the sensation that the limb is still there as normal, but it's become smaller, shrunk somehow.
And I understand that you have a treatment trial going on in the hospital at the moment.
Well, yes. I mean, in the normal course of treatment, we administer analgesia, and we also make use of local injection therapy using pain-blocking agents. Unfortunately, though, these don't always work as well as we might like. So we're working with a group of patients who have reached the point where the pain's badly affecting normal activities such as sleeping and going to work. All patients in the group have suffered from phantom limb pain for 10 years on average. So they're the most extreme cases we could find.
So how did you set about treating the patients in the trial group?
Well, when a limb is lost, that affects a number of brain functions, and we wanted to try to restore those functions. So we attached electrodes to the remaining muscles of the stump, and then asked patients to try to move the phantom limb. And patients could view their virtual limb moving on a computer. But they couldn't just imagine moving the limb, they actually had to force their brain, if you like, to perform the action. Because only then would these circuits, these pathways, be restored in their brains. So the patient controlled the virtual limb just as they would have with their own limb. And slowly, they got better at doing this in a way that was productive to the brain. And patients invariably reported that as a result, their pain diminished.
So the treatment was useful. Does it have any other advantages?
Well, we followed up patients after different periods of time, and the improvements were still there, but not to the same degree. But the decrease in pain levels was still statistically significant. But this kind of treatment is very easy for patients to do at home once they've left the hospital. They only need a computer with a webcam and the program.
And this research is ongoing, of course, so we can look in
Extract 2. Questions 37 to 42.
You hear an interview with Dr. Delia Mean, who was Team USA's Chief Medical Officer at the Sochi Winter Olympic Games.
For questions 37 to 42, complete the notes with a word or short phrase.
So, Dr. Mean, what did being CMO mean?
Well, it meant overseeing 77 other healthcare professionals and taking care of 228 U.S. Olympians. As a CMO, I worked in tandem with a team to deliver the highest level of care to our athletes. We were using the latest technology, evaluating a mix of treatments to ensure peak performance, and were ready to respond to whatever might have come our way. It also meant working long and busy hours during the games, where the team faced everything from common colds and illness to traumatic injury. And it also meant having compassion and understanding while applying your medical expertise in a fast-moving environment.
Can you give me a behind-the-scenes description of what the medical support of the athletes looked like?
Yes, absolutely. Well, it looked pretty much like any medical clinic you might be familiar with. There were dozens of boxes shipped to Sochi so that we were able to care for our athletes. Our doctors saw everything from coughs and flu to sprains and breaks. As a result, we had a comprehensive team assembled to address whatever health-related need might have come through the door. We looked like a mix of care providers such as athletic trainers and physical therapists or chiropractors and massage therapists to assess and provide the best solution to the problem. Our goal was to have our athletes back on the slope, track, or rink as fast as possible, performing at their peak.
I see. And who cared for the athletes if there was a life-threatening injury?
Well, if a situation like that had arisen, and I'm very happy to be able to say that thankfully it didn't, the intervention of doctors, specialists, and emergency providers from the Olympic Organizing Committee and our Team USA doctors would have absolutely been vital. We always had one of our physicians with the team during training and at competitions at the various sites. That gave us the flexibility to provide immediate care should the situation have occurred. We felt pretty confident that through our collaborative efforts, we could care for our athletes in just about any situation.
Well done. And how did you approach injury prevention?
Preventing injuries was certainly a major part of the support we provided. Aiding athletes and coaches to condition appropriately and prime their bodies with good nutrition and recovery efforts while in Sochi was all part of the whole care that we provided while we were there. We were able to use technology to assess and evaluate our athletes to ensure they were at their peak to perform. The travel and extreme competition did take a toll on the athletes' bodies, but we did our best to keep our athletes healthy in every respect.
And were there any new technologies used by the US medical team in Sochi?
Well, one of the tools we used was a groundbreaking form of software which provided our physicians and athletes the ability to communicate health information instantaneously and securely. The software maintained diagnostics, treatment evaluations, and test results, and it was all accessible virtually. This was especially critical when we were traveling from venue to venue in a foreign country. I have since actually implemented this same software in my private practice. Now, no matter who is involved in the patient's care, the healthcare professional has easy access to all the critical information and can respond accordingly. We also had several ultrasound machines that we traveled with, which was an incredible diagnostic tool for many musculoskeletal injuries.
And finally, how might other young physicians follow in your footsteps?
Well, I would encourage any physician that aspires to this kind of appointment to begin connecting with officials in their area of interest. My work with the U.S. cycling team helped build my reputation among other elite sport organizations, where I was able to establish relationships and convey my interest in working with them. You know, it can take a lot of time volunteering, but the work is invigorating and stimulating because you learn so much in the process, especially if you're passionate about it. I really do believe I am a better physician and surgeon because I've had the chance to work in these various situations. I can bring that experience back to my private practice, which elevates care for everyone.